There we go. All right. Hello, everyone. Thank you so much for being here. We have a small but mighty crew, but I am really grateful that all of you are interested in participating in this panel. My name is Kate Bruns. I'm a second year PhD student in communication studies at the University of Minnesota Twin Cities. This is my first time arranging a panel, so thank you all for bearing with me. But I was feeling particularly over this last year. There were so many problems going on in our world: health, politics, environment, just everything really hitting the fan. And I felt as though there were many academics and practitioners like us who were working on ways to combat these problems. But we had to pivot a lot because of the pandemic. And I was just interested in, hosting a conversation around some of the work that everyone was doing, engaging publics and communities and universities, just to hear strategies and tactics for what was working and how people were staying sane during the year of 2020. So I don't want to take too much time to introduce obviously us, but I guess I'll get us started then with our first panelist, Jennifer T. Edwards from Tarleton State University, who will present her research From Rural Grocery Stores to Gas Stations, promoting the 2020 census during COVID-19 pandemic.
Well, thank you so much for the opportunity to present. As you can tell from the title, this past summer, or 2020 just in general, was very challenging. Not only because we were during the beginning of the COVID-19 time period. It still hasn't ended yet, but I am in Texas. But not only because of COVID-19, but also because of the rural areas. So it was very awesome to work with and within a rural area. So we're defining rural as outside of a major metropolitan area. Most of the counties in Texas, we have counties, and most of the counties in Texas that we worked within have less than 50,000, 40,000, even 30,000 people. So these are very rural areas. Most people either live in a small city or an incorporated area, or they might have a house on an acre of land. So you're reaching people who traditionally would not be gathered in a central location anyway, but you're reaching them, educating them about the census, and explaining why it's important, all during COVID. So here we go. My name is Jennifer Edwards, and I'm at Tarleton State University in Texas. And I also am the executive director of the Rural Communication Institute. And with that comes a lot of challenges. So I actually had to recruit. We were not able to employ students at the time, so that was a drawback as well. And so I had to recruit my husband and my 9-year-old daughter, or 8-year-old at the time. And so we stood out in front of City Hall. And so with that, we had to wave at cars going by on the main thoroughfare of town, in front of City Hall, because we wanted to increase the awareness of the census and why it is important. So we also had some freebies, and we'll talk about those in a few moments. This is me, Patagonia hat, and also we had free t-shirts. And so with the t-shirts, those were important in the rural communities because a lot of our department stores closed down. And within these department stores, those are where, except for Walmart, of course, but that was restricted as well. So if you needed free apparel, you could come get those at the booths that we hosted during COVID in the Tri-County area to promote the census. We were also very focused on pain points of the community. And so I realized that I was having pain points, but then Evangelina, who is wearing the census t-shirt, she reached out to me. And so we just connected. She was working for the Census Bureau. I was working for Tarleton State and funded by the Hogg Foundation to promote the census. And then the person who's wearing the Northeast Texas Count shirt with the hashtag, he is actually one of our student interns that I recruited from another institution within this area. But we stood outside of a bank. And we stood outside, the bank president, who is standing right behind me, and the mayor, who's standing behind her, all came out, and we stood on the side of a highway to capture people on a Friday when they had to cash their checks or deposit their checks. And we talked about the census. So we were able to register convince a lot of people on site to do the census as well. Oops. This is, we have a lot of rural post offices in Texas. And I did not realize how many rural post offices we actually had until doing the census. One neat thing about the post office is that the main lobby area is always open. So I could leave census information there, even though the post office, right now the post office in Texas is not open on Saturdays. So that basically means that people were able to check their mail and then grab some census information at the same time. But that was in a community of like 200 people. Then we were able to go to downtown sections. We had our t-shirts, we had small, medium, large, extra large, XXL, and then I realized how many people wanted 3XL. And so that triggered something else that I'll talk about in a few moments regarding health and awareness within the community as well. But we did various booths with the census employees as well as with our student help as well. But this is then a downtown community. One thing I wanted to highlight was that residents in rural areas experience unique barriers. Not only do they have lower educational attainment levels, but also they experience less job opportunities because many of our larger corporations want to be co-located in a very metropolitan area. And because they receive tax incentives, and in our rural areas, they have no idea what a tax incentive, for a corporation actually is. So we're working with them on that as well. But they have less access and opportunities to access information, and they have limited access to the internet. Some of the residents that we were reaching are still on dial-up. Some of the residents that we're reaching, especially even in that past picture, they do not have access to high-speed internet. So most people are on hotspots, and those hotspots are super expensive. So various barriers to reaching our rural residents. And then also even with the mayor, we're working with the mayor right now that you just saw in a prior picture, because he wants to apply for these statewide and nationwide grants, but he does not have the personnel to do so. So that's where we come in as well to help bridge the gap between state, national, and international resources in our rural communities. So our 5 rural approaches for this Northeast Texas Counts campaign was to focus on pain points. We thought about the items that even during COVID and social distancing that people had to have. So you have to have gas for your car, you have to have clothing, you have to have food, and also you have to charge your devices. So we had the wall plugs, the USB wall plugs, and we also had a multi-prong cable that had like Apple, Android, and also a C cable. So some people would say, oh, well, I don't need one because I have an Android. Oh, no, what? We have you. Don't worry about it. And so those were high in demand items that people definitely grabbed. We were completely sold out. I say sold out, but we gave out all of our t-shirts because people really wanted those. Also, I did a kind of a DoorDash. I realized with school districts, teachers wanted access to, things for their classrooms. So you know what, back to school, we're going to have stuffed backpacks, and you're going to get something for the census in your students' backpacks so they can take it home. And then also with the I made a Google spreadsheet, not Google spreadsheet, but a Google form. And on that form, I sent that to all of the school districts within the 3-county area to say, if you want a t-shirt, fill out this form and I will personally deliver it to your school district. So I did a lot of DoorDash or census dashing, I guess, as well. So that was a reaching rural educators. Also building relationships. I have never, usually I'm a introverted extrovert, but with this campaign, I had to be an extroverted communicator because people were always asking me about the census, and I was known as the census lady, even though I did not work for the census. I work for Tarleton State. So, just building relationships. Also with the I have a Dymo. I love my Dymo machine, but I didn't realize how much of a role it would play in the census. So we actually did a informal communication campaign with those rural outreach stickers. So if you get a census t-shirt, you're also going to get a sticker with a QR code on it. And that QR code will say like, scan this with your phone, with your picture app, and that will lead you directly to the census homepage or how to complete the census. And it was funny because many of our census counterparts who were volunteering with us were like, this is great, we're going to use this too. So we were able to influence large scale governmental communication with that as well. So infographics, we'll talk about that in a few moments. But as I stated, the t-shirts, the USB chargers, the iPhone, Android chargers, also we had snacks as well, but it was very effective at reaching hard to count populations. I did not realize how much, I mean, I know people in college, they love free stuff, but I didn't realize how much people in the community love free stuff as well. So this definitely, even if we're on the side of a major highway, people would go and turn around just to get the free stuff, and they would fill out the census there. One thing I do want to highlight is that we, working for Tarleton State, I was not deputized. So we had to rely on our census counterparts to help people who perhaps did not know how to navigate the website or did not have a cell phone on hand. They had to actually help them complete the census, and we were the front people, and then we connected them to our census counterparts. So we made little infographics. Canva was definitely our friend. And so we put our counties against one another. You know, why not? So we have Panola County, Shelby County, and Rusk County. So each and every week we produce this and put this out on our social media channels. So it was neat because they were able to say, oh, well, Rusk County is winning this week, or Panola County is not too far behind. But also our city and county governments also got in on the action as well. They're like, well, we don't want that city to beat us. We really want to win. So this was a big piece as well, to put all of these small cities against one another. They compete in football, basketball, track. You might as well compete in the census. So we were able to award first place, second place, and third place. Best practices for rural census outreach. We partnered with the East Texas Food Bank. That was something I forgot to mention. We partnered with the food bank, and every time they gave out their huge boxes, we were there helping people, helping load boxes, but also we have the census sticker on there as well. So that was very, very good with outreach efforts. And it was a humbling experience for me because I've never volunteered at a food bank, and also our students have never volunteered at a food bank either. And it was interesting to see 250 people in line for an event that I thought only 20 people would attend. And then I had a chance to translate or to utilize my Spanish language skills as well. So that was good at reaching the population as well. Also, our t-shirt strategy worked very, very well. There were walking advertisements. So we would have people to come up and they said, well, we saw this shirt 2 hours from here and we definitely want one, because, you know, Northeast Texas counts. And so they wanted t-shirts as well, but they were resistant to visit stores to purchase clothing. So they were very excited to see the shirts. Our grassroots approaches worked better than the traditional community engagement strategies. And I'm saying that because when we received our funding from the Hogg Foundation, we had like weekly meetings, and they're like, oh, well, you need to contact city government, or you need to go to the city council meeting, or things of that nature. That did not work for us at all, because people weren't going to those city council meetings. And then even the census, whenever the census contact reached out to me, and she said, I haven't been effective at reaching these rural areas. They told me to go to the city council meetings and you know, to the churches, but we're not really reaching people. And I said, you know what, forget that. We're going to start from the ground up. So we did our march. She joined in with me. Every time I had a booth, she had a booth, you know, there. And so we went from the ground up, and we reached people that those traditional approaches would never reach, especially our ethnically diverse populations. Also, we started connecting with local store owners for the booths. And so that really helped as well, because those store owners were able to put us on their social media pages. And also we provided our local census workers with t-shirts. That was surprising. I did not realize that the census workers were not supplied with anything else than a bag. So the only thing they had was their little shoulder bag, and that's it. So they were so excited to receive personnel. The personnel was very excited to receive t-shirts, because they said, we walk up to these households and they do not know who we are unless we show the bag. But if we have a shirt, we can actually establish some credibility in the community. And they felt safer wearing the t-shirt versus, you know, just a regular everyday attire. Okay, and then this was, we did reflect on the census, and this video is actually linked in the notes, but that was our, let me see if I can pause it. That was our experience with the census. It was a great opportunity to connect with the community. Actually, the city of Beckville, which is located in one of our areas, beat their 2010 census numbers by 25%. So that was incredible to see that. So out of this entire 26 county area, that was the only city that experienced an increase, and that was one of our cities. So that was a point of pride for us, but also we have various notes that's going to help us with the 2030 census. And last but not least, I wanted to highlight that many of the census workers actually we had many conversations, and they drove from even 4 hours away to have a presence at our census booths. And so it was very interesting because the census workers said, well, I've been working on the census since 1990. And I'm like, you've been working on the census for that long? So every 10 years, this is her thing. And there were various volunteers working on the census, or census workers who have been working for various years. So I just want to highlight the importance of the census, how it makes a difference, and thank you so much for listening.
Thank you so much, Jennifer. That was wonderful. So I'm actually really excited because from our program, I'm the next up, and my work, I think, connects really well to your work, Jennifer. So this is perfect. All right. It looks like everyone can hopefully see the slides. All right, so hello again. My name's Kate, as I mentioned, second year PhD student at University of Minnesota, Twin Cities. And I'm very excited to be here, being able to present my team members and our community partner, the City of Little Canada, to present our project, the Pioneer Park Master Plan, Best Practices for Community Engagement. And I think similar to Jennifer, a lot of our work evolved over time. And many of the problems, Jennifer, that you just recognized coming from city council and feeling as though, some of these city organizations are not actually engaging with communities, that was something that my team also realized while working with our community partner, and led our project kind of to shift a little bit. So I'll talk about that. All right, to get us started, I'll provide a little bit of background context. This particular project evolved out of a University of Minnesota initiative called the Resilient Communities Project Fellows Program. And the goal of the RCP Fellows Program is to partner graduate and professional students with Minnesota cities to further projects that aid community resilience and innovation. Hence why I felt it was so important to present at this particular conference with a resilience theme. Our team for this actual project was made up of 5 master's and PhD students from across different disciplines and all at different stages in their academic career. So having that variety of background experiences, of methodological approaches, of ages and locations around the Twin Cities area was really vital for us being able to approach this from a different perspective and do something kind of groundbreaking in terms of community engagement. Our partner for this project was the City of Little Canada. And if you are not familiar with the Minnesota area, I've included a map over here. So Little Canada is a suburb of Minneapolis-St. Paul. It's about 15 minutes from the University of Minnesota campus, and it has a population of about 10,500. So it's pretty small. But even for its size, Little Canada was very involved with our project the entire time. And that was very purposeful and by RCP design. So the RCP program focuses on a model called community-based participatory research, which essentially emphasizes having an active and equal partnership between researchers and the community. They don't want researchers to kind of fly into a community, do their thing, and then leave and never to be heard from again. It really is an evolving process. You want to make sure that you're addressing the need, but you're also using your own experiences to suggest alternatives if a given approach is not working. And this is where the community need was interesting. So our team of 5 was originally brought on in June 2020 for a summer fellowship that would end in August. And we were asked to help the City of Little Canada conduct community engagement during the pandemic for the purposes of collecting data that could be used to develop a master plan for one of their community parks called Pioneer Park. But when our team started working on this project and was, considering different tactics that we could use, some of what we learned in the very early stages led us to feel that we needed to actually pause that whole Pioneer Park community engagement portion. And you'll see why that happened in the next slide. My teammates and I, being grad students, all did what all grad students do, which was we looked at past literature. So we looked at the research about community engagement and kind of started getting some ideas of strategies and tactics. But we also turned to looking at Little Canada more in depth because none of us were from that community. So we did a site visit to the specific park that we were looking at, developing a master plan for. We did a deep dive into some of the city's planning documents, including their master plan for the park system and their strategic plan for the city as a whole. And then most importantly, we spent time interviewing people to learn more about Little Canada's history. Because if you can imagine, Little Canada has a strong relationship to French Canadian settlers. But before the settlers were there was a strong Native Dakota population. And that historical aspect kind of started getting our wheels turning. And the more that we learned about Little Canada's history and where the city was now, we realized how diverse this very small, like 10,500 person city was. And when we compared that diversity to what we were reading about in the engagement literature, we became a little cautious because we felt that it was necessary to do engagement that would definitely be equitable across the whole community, especially because we were working on a master plan, and master plans are there for many decades and they're informing large design strategies for the city. So we wanted to make sure that the city was doing it right. So instead of just launching into doing this community engagement for the park, we actually paused that portion of the project, went back to the city and said, look, before we do this, we think we need to take a step backwards and develop best practices for what community engagement looks like in Little Canada overall. And we had to kind of pitch it because they were cautious, because that's not what we were brought on to do. But we felt that if we developed these best practices, they could then be used to inform an engagement plan for the Pioneer Park project, and could also be used by the city and replicated throughout other projects that they might do that were unrelated to the park system. So ultimately, we got the go ahead to do something that we were not brought on to do originally. And in order to come up with those best practices, we started looking at community engagement guides and case studies that had some sort of best practices, like big picture model. So we used those to get big ideas. And then we also examined what ongoing community engagement was being done during the pandemic in other areas. And some of those were specific to parks in the Twin Cities area. So we were able to get ideas about that. But some of them were also campaigns, art projects, big things that are being done internationally and nationally. And so that was very helpful. So we used all of that information to kind of come up with some ideas of what community engagement should look like in Little Canada. But of course, we also saw that Little Canada has some very unique challenges, and it had specific needs that were not addressed by just generic strategies. So the final part of our report became this idea of providing pragmatic tools. So we worked with city staff and city council to conduct a stakeholder analysis that identified specific community groups and populations that were key to the park planning process. We also developed 2 assessment tools for the city to use. One that would help them evaluate the equity and accessibility of all of their engagement designs to make sure that when you are doing focus groups, sending out a survey, those sorts of things, are you hitting those equity components effectively? And then also another tool that helps them process the feedback that they received from communities to consider things like power. Right? So when someone comes to you with an idea, is this an idea that you want to act on, or do you need to explore more closely? The last tool that we created for them was some community definitions. Because what happened was early on in the project, we're having conversations with planning commissioners, city council members, and our team keeps referring to these, buzzwords like equity and sustainability and diversity. And the whole city's like, that's great. What do those mean? And we did not have specific definitions for them. So we worked with city staff to identify 8 kind of big picture words like the ones I just mentioned, and help them come up with definitions and meanings for what those words mean to the city of Little Canada, and most importantly, how the city should go about measuring their progress in fulfilling those objectives. So when you say you want to have more diverse engagement, what sorts of things do you have to verify are happening in order to say, yes, we had actually done like diverse engagement of the community? So that whole report, the best practices, the tools, all of that came together to guide some recommendations that we had for the city. And many of the recommendations you can see on here are sensible, right? You know, engage stakeholders and maintain those relationships over time, balance top down and bottom up approaches, like those are sensible. But one of the ones I think is particularly interesting and important for this project is this first recommendation that we made, which is that the city investigate and emphasize a well-rounded community understanding of Little Canada's diverse history. And this recommendation was especially critical to the Pioneer Park project because of some of the things that were being discussed by the city as improvements to the park. For example, there was talk of incorporating a pioneer theme into the park playground, even having the name Pioneer Park in an area on stolen Dakota land. Our team was very cautious about some of those decisions and wanted to make sure that they were truly being considered by the city before they went ahead with those. So this recommendation helped us suggest to the city that they take steps to acknowledge that their community members live on land that was stolen from Native Dakota populations. And above all, that Little Canada has a history that began before the French Canadian settlers arrived there. So that needed to be taken into account when the city was designing all of their engagement efforts. That way, Indigenous perspectives and representatives who were participating in these processes felt seen, felt heard, and felt respected. And that was going to ultimately shape and maintain the best stakeholder relationships over time. So at this point, you're probably wondering, again, this is all great, but you weren't brought on to do this. So what's the status of the actual Pioneer Park master plan? So what happened is our team finished this whole project in August. We gave them the best practices report. But during our final presentation, we all felt so passionate about seeing this project through to the end that we ended up coming back into the fall in different capacities. Some of us as interns, some of us as just like volunteering odd time. And we worked with the city to conduct the actual Pioneer Park engagement that we had originally been brought on to do back in June. So this became a two-part project. And this flowchart represents the master kind of plan that we ended up having for engagement overall. And I think it's most important to stress that the work we did in the best practices did actually inform this plan. So the stakeholder analysis that we conducted informed these kind of top 3 stakeholder groups that we centered this entire process on. The case studies that we investigated about best ways to engage with minority or at-risk or vulnerable populations helped us figure out the best ways to engage with these stakeholders in this situation. So we knew we couldn't just, for example, send a survey to K-6 students. We had to do something hands-on and interactive. So we did an art project. For the Native American communities, we felt that we needed to have more one-on-one attention. So we did focus groups and interviews, which was more time consuming, but brought us richer data and maintained those relationships that the city needed in the long run. So ultimately, this whole engagement design was really underlined by all of the recommendations that we made for the city at the end of the summer. At the end of this project, we succeeded in engaging upwards of 1,000 community members, which for Little Canada is about 10% of the population. And the city was absolutely thrilled. So we finished this back in December. They have all this data and the city is now taking that and working with the company to actually conduct the master plan that they had originally been discussing. If you're interested in learning any more about the best practices report, I've posted that onto our Pathable site. But I was mentioning to Jennifer earlier, I'm actually hoping to present the results of the youth engagement portion that we did over the fall at the International Environmental Communication Conference in June. So if you're interested in learning about a K-6 art project, feel free to check me out. But this was a huge undertaking for all of us, and I'm so grateful for our community partner, the support of RCP, all of my team members, because this was a lot to do, and I'm confident that we did it the right way. That's what I got. Yay. All right. Now we're on to what looks like our last panelist. I'm very excited that you're here, Esmaeil. So finally, to wrap us up, we have Esmaeil Esfandiary from Tuskegee University to present right-wing narratives on COVID-19 and perpetuation of health disparities in minorities.
Thank you very much. Thanks. So let me see. Just share my screen. You can see my screen, right? Okay, so good morning, everyone. My name is Esmaeil. I'm an assistant professor of communication at Tuskegee University and HBCU in the South. So I am presenting my paper on the intersection of rhetoric and engagement. So let me see how I can start. Okay, so my question that I had was, so let's start from the introduction. So the history of COVID. Last March in the middle of the semester, COVID came to the U.S. for the first time, and all of a sudden the entire country went on the lockdown. It was probably early March of 2020. The administration, Trump administration, kind of quickly formed a task force to coordinate the government's response. And something really big started in terms of communication that I think that you all remember, and that was the president's daily press conferences. So every single day, for hours, they would kind of stand in front of the cameras and talk and talk and talk. Networks would cover it, and it became the big kind of news cycle issue of the day. And when we going back, we should also remember that those times are really, really, people were really panicking, and no one really knew about the virus. No one even knew how it's spreading. What are the dangers? What should you do? There was real kind of thirst for information. There was real panic. There was real uncertainty, and millions of people were losing their jobs every day because the entire country went on a lockdown, remember, for 2 weeks. So like 10 million or 20 million jobs just went away in that time period of 2 weeks. And then so there was this huge kind of thirst and need for information, and that was the time that these press conferences were designed. So the overarching question that I had for this research was, how did the president portray the virus? How did he label it? What was the framing that he used? And I'm using this in relation to engagement. So we know, of course, that when you're dealing with the pandemic, you need to engage people. You need to work with communities. You need to make sure that people understand, people kind of take care of themselves, people kind of take, cautionary measures. So I was thinking, like, how his framing, his portrayal, his narrative was related to healing. And as you see in this picture, the president is talking, and that's basically what I was trying to understand in this research. Is my internet connection bad? Can you hear me?
You broke up a little bit, but I think you came back.
Okay, yeah, I'm hoping that doesn't happen again. Okay, so a little bit on the literature. So I took advantage of the literature on strategic narratives, which is pretty kind of famous in political communication and international communication. So just a couple quick quotes, and I kind of jump to the methods. So strategic narratives are a means for political actors to construct a shared meaning of the past, present, and future. Actors work to frame their own character and that of others by selecting and highlighting some facets of their history or actions in order to promote a particular interpretation and evaluation of their character. History, analogies, metaphors, symbols, and images are used as resources, in constructing these narratives. So basically, the point here in this, in this literature and in this framework that I'm using is that the narratives, the portrayals that politicians construct are not, kind of coincidental. They're not, they're not without meaning. They're strategic, of course, right? So what I figured, would best serve me in this research is, for my method is metaphoric criticism. And the reason for that is that when, going over the president's, press conferences for about a month that I'll explain in a minute, I figured he uses metaphors a lot. So, certain metaphors were repeatedly used, extensively used by him. So I chose metaphoric criticism as the method. So, again, a couple of words on metaphors and metaphoric criticism. I'm sure you've heard of lack of. So the essence of metaphor is understanding and explaining one kind of thing in terms of another. In allowing us to focus on one aspect of a concept, a metaphorical concept can keep us from focusing on other aspects. Again, going back to the strategic narratives. So you pick a metaphor to basically portray the issue or the topic or the question in a certain way. And finally, to study metaphor is to be confronted with hidden aspects of one's own mind and one's own culture, that one has a worldview, that one's imagination is constrained. So metaphors, are very interesting, in our, and I'm pretty sure you've probably encountered this issue in your, studies in communication. And the big thing about metaphor is that it's so widespread and it's so, even unconscious in many cases. So, for example, research shows that when engines came about a century back, automobiles, cars, people started to make sense of their lives in terms of engine. So they said, my heart is an engine, my mind is an engine, society, has engine. So of course, this is a metaphor, there's no actual engine, literal engine. But people started to make sense of issues in terms of, the mechanical metaphor of engine. When digital technology came by, networks came by, everyone started to make sense of society, in sociology, communication, relationships as networks. Like network web became the big issue, right? So because of technology, so basically what it means for us and for me in this research is that it constrains our perspective. So you look at things based on, my mind is like a calculator, society is like a network, my heart is like an engine, right? So the point about these metaphors is not only you constrain your perspective and understand things in a certain way, but also you basically, as the second quote says, a metaphoric concept can keep us from focusing on other aspects. Okay, so the unseen, the unattended, right? That's also the big part of metaphors. Now, so what I did, I basically pulled the text of press conferences. There were extended, long press conferences, as for months. It went on for months. So I chose the very first, frame, time frame, which is from March 13, the very first one, to April 18. So this is the first round of his press conferences. There were a couple, points and changes that they did. So this is the very first round. I read, the thing, and I analyzed that, his metaphoric portrayals of COVID-19. And, again, this is this is the early phase of the pandemic. We should remember, there was kind of in national lockdown, everything was closed for 2 weeks. Millions of people lost their jobs, and there was huge panic. We didn't even know how the virus operates, and what are the symptoms, what are the, if you get ill, what happens to you. So there was real thirst for information. So it was, this is all to say that there was huge impact, right? There was huge reach. Like you have the, the first, you have the president of the country, the chief, person, or healthcare, officials, everyone kind of talking to people for hours every day, right? So what results? What I figured was that there was an overarching metaphor that was used extensively, and that was the metaphor of virus as enemy. So every single day he would say that the virus is the invisible enemy and we are in a war with this enemy. So I've chosen a couple of the quotes just as examples, based on the date. So we have to find, these are exact quotes from his from his talks. So March 17, we have to fight that invisible enemy. We're going to defeat the invisible enemy. These are of course all metaphors. There's no enemy. You're not going to defeat it literally. So these are all metaphors. Americans are rallying together to defeat the unseen enemy, striking our nation. It's now attacking. The enemy is attacking 144 countries. We got hit by the invisible enemy. We are in a war. The invisible enemy. Remember. We will win this battle. We will defeat this enemy. We're attacking the enemy on all fronts. So you see, metaphor after metaphor: winning the battle, defeating the enemy, attacking the enemy, fronts. These are all, of course, metaphors. Our ongoing efforts in the war against the invisible enemy. Substantial progress in our war. Our nation is engaged in a historic battle against the invisible enemy. To win this battle, we have undertaken the greatest national mobilization since World War II. So literally, kind of comparing to the Second World War. Now, so there, lots and lots. There are literally hundreds of metaphors that basically portray the virus as enemy, and we as being in a battle and kind of attacking and defeating and stuff like that. So nurses are the frontline soldiers, tide, military going into battle, rallying, soldiers of the war, so warriors, all those metaphors. So just a couple quick numbers so we have a better sense. So I basically analyzed 33 press conferences, almost a month. Only the term invisible or hidden enemy was used 31 times. So almost at least one time every day, every press conference. The terms battle, frontline, fight, war, or warrior were used more than 130 times in the 30 press conferences that were analyzed. So it was really used extensively. That was like the underlying kind of frame for every single press conference that the president had. So now when you think of these metaphors, question and going back to the literature, if this is not coincidental, and if these things are thought out, and advisors, president, they have purposes and they have strategies behind these portrayals, again, every single day, hours and hours, repeating it. What's the point? Why should the president do that? What's the political kind of implication of this? So basically, my argument is that using these metaphors, President Trump was turning a public health campaign into a war or a military campaign. So how did it work? Why should the president, turn a public health campaign, into a war campaign? And what are the consequences? What are the implications? So we know that in a war campaign, the whole nation would quickly unite under its leadership, would quickly mobilize. The leadership, becomes able to create national consensus. Remember actual wars, like actual countries, getting involved into wars, and they can demand obedience from the nation, from that, from the civilian structure, from the military structure. Basically, the space for debate, for critique, for disagreement will shrink, day by day. Things like criticism, dissent, difference can become, signs that you are not patriotic, right? Because it's a war, it's serious. And basically, an image of strength, heroism, determination, kind of, all sorts of, those types of images get circulated, by the media, by the president, by the government. So basically, it's gonna give the president more authoritarian powers. All of a sudden, the system, society, culture, media becomes more authoritarian. What he wants to do. So now, what does it have to do with our theme, which is engagement? And this is my last slide. So basically, the question, and going back again to the literature that says, a metaphor constrains our perspective and makes us see things in a certain way, while it will keep us from seeing it from other ways or other perspectives. A question that that might be asked is that, okay, what's unnatural about this? I mean, what's the problem with this portrayal? What's the problem with this metaphoric portrayal? Virus at the end of the day is attacking us, right? People are losing their lives and we are fighting it. So what's the problem with this? The problem is that, again, going back to the literature, we shouldn't take it for granted. We shouldn't assume that it's natural or normal. We should look at we should be critical and look at the implications of such a narrative. So to have, another example of, and to prove that it's not necessarily the only way to portray the issue, we can look at other countries. So some other countries who did much better, like New Zealand and Germany, who happened to have actually female leaders at the time, constructed a narrative that was totally different than this. And they actually did much better, in terms of, containing the virus and the pandemic. So what happened was that those leaders actually became more accountable. They practiced more listening. They showed more humility and empathy to everyone, to the doctors, to the healthcare system, to the people, to the communities. They showed more respect. They actually did more listening than speaking. The president here would talk for hours. They would, practice more listening. So they basically they didn't become more authoritarian. They actually became more participative and they became more engaging. So they gave up some of their power and they shared it with qualified experts, right? So in Germany, in New Zealand, it wasn't like the president or prime minister, whoever, did what they wanted. They actually, let the scientists and experts, take the initiative and design the policies. So basically, overall, my point and my argument is that, the narrative that the president used, led to more authoritarian, handling of the situation, and that, of course, wasn't the natural, quote unquote, way to do it. And there were other possibilities to handle the situation.
Yay.
Thank you very much.
Thank you so much for that excellent final presentation, Esmaeil. Now that all of us have gone, we have the pleasure of hearing from our respondent, Monica Evans from the University of Minnesota Twin Cities. I'm very excited to hear, Monica, what you thought of all of our presentations.
Okay, I am going to try to draw the through line for all of your presentations. As Kate mentioned, my name is Monica Evans. I'm a first-year doctoral student of communication studies at the University of Minnesota Twin Cities. And I just want to take a moment and say all of you are doing amazing work that is in many ways inextricably linked to one another, whether that be in Little Canada or in rural Texas, locating resilience, embodied activism, and social justice within the microcosms of communities that have histories of exclusion and marginalization is forcing us to examine the nature of these issues and how to best create and enrich our communities. While COVID has fundamentally changed the ways in which we build community and also the ways in which we can hold space for community, all of our panelists continue to engage with how we can best reach out to these communities that are underserved and potentially silenced. One thematic through line of all these works is intersectionality. The communities engaged with in these works are very much at the crosshairs of social, economic, educational, political, racial, and health disparities. In Patricia Hill Collins' 2019 book, Intersectionality, she states, as a discourse, intersectionality bundles together ideas from disparate places, times, and perspectives, enabling people to share points of view that were formerly forbidden, outlawed, or simply obscured. This community building and engagement that you all mentioned is taking place within that discourse of obscurity. This discourse of resilience and social justice is developing out a framework for shared community understanding. I'm going to talk about Kate's campaign first, which I think very much emphasized a lot of this shared community understanding, from starting with building out from an interdisciplinary team to creating a shared vocabulary with the community that can be extrapolated and interpolated. And I challenge our other panelists to use this to explicate that in their own works. Also, I'd like to take a moment to commend Kate on the extensive nature of the campaign and the engagement design, from the COVID precautions that you mentioned to the mixed methods you used. But also in your final recommendations, and I know you are working to build it out more, I would have liked to see some implications for branding of the parks, and if that had any potentiality on connecting with the community. I know you said that might be a later project, but definitely came to mind. Another question I'd have for you is, how do you see this park or this project is being connected to other systematic issues within the community? How is this park truly a touchstone for resilience? Moving on to Dr. Edwards' work, I appreciated your use of an autoethnographic entry point into your scholarship. This causes us to consider the relationality between our scholarship and whom our scholarship serves. One challenge I'd ask of all of our panelists is to consider how your positionality is playing into your scholarship and into your community outreach. Is it insider looking in? Is it insider looking out, or outsider looking in? Because there are definitely implications of both of these approaches and implications for the outcomes. Also, as part of Jennifer's work was focused on the pain points of the community. What does it mean for our scholarship to operate from a position of deficit? This is a consideration that's probably a different project, but I definitely like everyone to consider it. Also, in Jennifer's work, I wanted to see a bit more detail on how the digital divide factored into your work. I know you mentioned it as a barrier, but in the era of COVID, internet access is becoming increasingly more important, and I would have liked to see a bit more on that. Also, your paper mentioned educators, gas stations, food banks as influencers within the community, which I found very interesting, but I'm wondering what other influencers in the community might you be able to tap into for future projects. I'm thinking of churches or other forms of organizing, maybe social organizing, not sure. Speaking of social organizing, I'd like to take time to bring in our absent panel member, Dr. James Carviou's work, which brings to the forefront ideas of social organizing, citizenship, and what it is that we owe to one another in a participatory democracy. While this panel is focused on resilience, James's work certainly centers resistance and solidarity that informs social movements like Black Lives Matter and Me Too in creating community engagement. His work leaves questions of, if public participation is what helps create communal social justice, how does individual social activism contribute, especially in the face of state slacktivism? But speaking of the state, moving on to Dr. Esmaeil Esfandiary's project, your work framed an epistemological intersection that I wanted to pull out of rhetoric and community engagement. The use of narrative and portrayals of metaphor to constrain a perspective, to create the unseen and the unattended, reminded me of Stuart Hall's definition of metaphor as a figural transference of meaning that aims to establish analogy, identity, and identification. Although your work centered battle metaphors, the actual battle that we can see taking place within the community, within the social political economy of the US, is health disparities. And I'd like to take a moment to consider some of the intersections that all of your works had. So how are we thinking about underlying rural health disparities, potentially in Texas, as echoing racial health disparities that are underlying that we can see in Esmaeil's work? How do we think of a park as a sign of communal social justice? How are rural census counts influencing community engagement? What is the through line? Is it poverty? Is it political zoning, inefficient access to health systems or spaces of health? This is all something that can be examined more closely. The work that this panel is facilitating, from grassroots level community organizing to state level examinations, has the potential to impact not only localities, but state and federal government communication and policies. I'll end this response with a charge to our panelists. I'd like all of you to consider the ontological, epistemological, and methodological implications of intersectionality on resilience, on your communities, and on our scholarship at large. Thank you so much.
That was fantastic. Monica, you made everyone on this panel sound so great. Well, also like giving us valid criticism, which is like perfect.
I'm glad
Well,
I did you all justice.
yeah, no, I thought you did fantastic. I think everyone did fantastic. Gosh, I really wish there were more people to come see how awesome we all were.
Stop the recording.
Yeah, I was just going to ask, are we okay if I stop the recording? All right, cool. Wait, why can't I hit stop? What the heck?